Hi, so my name is Jacob. I am the commissioner for the intake or outpatient facility. And what's your name?
Daryl.
Daryl. All right, Daryl. So, how are you feeling today?
Not very good.
I see. So, 'cause I know that you're referred to us by an emergency room social worker because you see you had a heroin overdose. Is that correct?
Yeah.
And is this the first time you've ever had an overdose?
Yeah, it's the first time.
It's the first time. Okay. And do you have any ideas of why it was just kind of different this time? Did you use more than normal?
Well, I was told when I was there that I tested positive for fentanyl, which is something that has never happened before. But no, I didn't do more than I usually do, anything like that. It was fentanyl.
Okay, so you end up having an overdose, and now end up here. So, I will say, so, when you're dealing with our clinic, anything that we discuss, now with me or any of our other providers, now stay between us. The only time that the confidentiality can be waived is if at any time you're expressing, or you might be harm for yourself or for other people. Does that make sense? Do you have any questions about that?
Yeah, that makes sense.
Makes sense? Okay. So, as you're saying, you end up having this overdose because good heroin laced with fentanyl. Okay. And how long have you been using heroin for?
I would say probably around 30 years.
About 3 years now. Okay. And just kind of want to tell me a little bit about how that addiction started.
So, I worked in the oil field for over 20 years, and then I ended up getting injured while out of a job. And when I got injured, they said that it wasn't considered a workplace injury, and I got fired.
Wow.
Yeah. And, being fired, I lost my insurance, and I couldn't afford to treat the pain that I was experiencing from the injury that was in my leg.
Also, it's in your leg.
Yeah.
Okay, you had the injury and you've been having pain just since then?
Yeah.
Okay.
It still hasn't really subsided.
Have you received any medical treatment since then for it, or have you just been self-medicating the pain issues with the heroin use?
I self-medicating. I can't afford to go to the doctor and get it checked out or anything like that.
Okay. And so are you still currently an employee?
Yeah.
You are just this point. Do you have any insurance, or are you still uninsured since the accident?
I don't have insurance. With the injury, it's been really hard to find a job, and that makes it really hard to get insurance.
Yeah, that really makes sense. Okay, so you said you started using heroin due to this accident. I'm sorry, going to using street drugs to do with that pain management. Okay, and have you ever tried to quit using the heroin? Since you started that 3 years ago.
I'd say about a few months in, I did, but the withdrawal symptoms made it impossible. Like I said, the injury was in my leg, and now when I was sober, not only was I feeling the pain from the injury, but I was getting cramps in my legs as it was wrong.
So kind of withdrawal symptoms is you were getting, you already had that injury, that pain, then you're also getting kind of these muscle pains. You notice when you've been using the heroin for a minute.
Yeah, it just made it worse.
Now, were you experiencing any other withdrawal symptoms?
I get really sick. Like I'd be throwing up, shaking. I just feel really hot and sweaty. It was not.
I said, no, I'm sure that those symptoms, that's what really makes it hard to get off of opioids, like heroin, fentanyl, and the painkillers, is due to withdrawal symptoms make it so hard to quit. And also with the cravings as well, because it's a very addictive drug.
I definitely. I'd wake up and just immediately be craving heroin.
So was there any, because I said you lost your job, you've been unemployed since. So, do you have kind of other stressors that you think helped go into the heroin abuse and also keep it going?
See, even before I lost my job, I, like, my family was already struggling financially. So the loss of the job just made it 10 times worse.
Because you're already having financial stress, and then all of a sudden you don't have a job. So that can be a very stressful thing. And how do you think that the heroin can help with the stress that you're dealing with financially?
Well, it just made me not really think about it. I wasn't upset or stressed out when I was high.
So it kind of provide you this escape from just the stress and the emotions of it.
Yeah.
Okay. And now, did you have any? One thing I always like to ask people is, did you have any kind of like maybe mental health symptoms or issues going on before you started using the drugs?
Yeah.
And like, what kind of like, symptoms were you experiencing?
I was just always very down. Like, life has been hard, and so, sometimes it was just hard to exist.
Yeah, that's definitely understandable. Life can be like that all the time. Did you ever try to get mental health, counseling or medication before?
That's not something we really do in my family.
So your family's not really supportive of kind of the mental health treatment stuff.
No, we just talk about it.
Talk it out, so you just raised to kind of be that way. Okay, and that almost kind of sort of ties into you had this injury, and you kind of found a way to tough it out. Not have to really try to rely on like receiving help. So what's your kind of like your current support system like? Like, are you married? Do you have any kids?
So I have a wife and I have a son.
And how old's your son?
He's 14.
Okay, and how does your wife and son feel about you trying to receive treatment?
They're really happy about it.
Right. Okay.
I think in a lot of ways it's changed me a lot.
Since you started using
Yeah.
years ago.
And I think they just want, like they used to have that.
That's definitely okay. And they kind of been expressing that to you for a while. And it's like maybe trying to get you to try to find treatment services. But you just felt resistant to that.
I didn't want to have to deal with it.
Just wanted to kind of just push it to the side and just try not to face those kind of issues.
Yeah. It's easier that way.
That makes sense. You were kind of saying it's like you were raised to just tough it out. So that definitely makes sense. So, how are you feeling now about trying to receive treatment services for your addiction?
Still not 100% on board, but I think I should do it for them.
So it's kind of that, it's just starting from around you a little bit.
Yeah.
So I'd say, like, you just kind of want to learn what treatment options you have available, so you kind of just start to weigh if you really want to fully engage in getting treatment services.
I'm way more open to it now than I used to be, just because I don't want to leave it alone.
So another overdose like that, it could just lead it to where, now your wife and kids have to figure it out on their own. So that makes sense. So now I'll tell you a little bit, we do outpatient services. So here we do have mental health counseling we do here. So that's something to kind of look into, since you said you were having symptoms of like depression, things like that before, and you're dealing with stress. So they can kind of talk, we can kind of get you with them, and they can talk to you more about what you can do to deal with that. And then if needed, they can also try to refer to a psychiatrist for medication management. So do you think that would be something you'd be interested in?
Yeah.
Okay, so we can definitely get you set up with them. And then when it comes to addiction, we offer medical assisted treatment. So, and it also has substance abuse counseling with it. But with the medical assisted treatment, like we use like methadone, Suboxone, or Sublocade. And so basically these medications are made to where they help, they are an opioid, but will get you on a dose to where you're not experiencing the high. But it can help with any withdrawal symptoms and cravings so that you can help abstain from that use.
Is that something that I would be able to afford to do?
So, there is obviously the self-care option, but with you being an employee, we also have a peer support specialist. So kind of what he does is he helps get people in touch with the resources they may need. So we can definitely get you in him, and he's helped a lot of people get insurance so that they are able to pay for these services. And he's also able to get you in contact with different financial resources, so maybe to assist in getting groceries, housing, and that kind of stuff. So we can get you with him. That would sound good?
Yeah.
Okay. And then, we also make referrals to, if needed, and if you think you need it, to inpatient services. So those programs, they can go from a couple weeks to 30 days. And those they can try to detox while in that controlled environment and receive other treatment services at the same time. Do you feel like you'd want a referral to inpatient services at this time?
It's kind of a difficult thing because, I have a family
Yeah.
and I want to be there with them. But I'm also not 100% sure that I'll be able to avoid the cravings.
Yeah. Which, that's definitely understandable, but that's what, sounds like maybe with inpatient, you wouldn't be ready for that. But, the outpatient you are, so we can really get you set up and started with that and see, how you're feeling after a while. And then we can maybe revisit that, doing inpatient services if you think you need it later down the road. Okay. All right. And then the other thing that we can also try to do is, especially get the insurance set up for you, is trying to get you a primary care physician so that they can help deal with the issues that you've had with your leg since that injury. So that would be good.
Definitely.
Okay. Yeah. So it's like that we'll make the referrals we need to, and so I'll get you set up with a peer support specialist, with the mental health counseling, and then we'll get you in with our care provider here, so they can talk to you more about the medical assisted treatment. So that sounds good. Okay, so we'll get that ball rolling. I'd say if you just want to come back in about 2 days, so I'd say about Thursday, or mornings or evenings better for you.
I'm gonna go with morning.
Okay, so how about like Thursday morning at 9?
Yeah, that should work.
Okay, so I'll work on coordinating with everybody else, and we'll just try to get it to where you can get in and see everybody and just see exactly all the services we offer, and then we can go from there.
Okay.
All right, then hopefully we can help you deal with the pain, the stress, the financial issues, and then obviously the addiction issues, and we can go from there.
Okay. Thank you.
All right, well, thank you for coming in today. That's not long enough. I'm going to put my head through the wall.